This is my trach suctioning and care video. So first, for this video, I'll walk into the patient's room, provide patient privacy, get the patient's name and date of birth, and verify their orders with the physician and everything. And so first, I'll come to the patient's room and assess the patient overall and their respiratory status. And if they need suctioning, or I'm going to auscultate their lungs and just assess the patient overall. And if the patient needs suctioning, then I can provide a towel here at first. If there's any gunk or any sputum that comes out, they can have that towel for comfort. And I'll explain to the patient that they're going to have some suctioning done. So to first begin with, I'll set the suctioning to 80 between 120, and then as well as turning up the oxygen so that they'll be hyperoxygenated, so that the stress of pulling off the oxygen back and forth can put the patient in some distress. So now I want to make sure to check their O2 sats at all times and their overall respiratory status. So I'll explain to the patient that they're going to get suction, and just first, before anything, just establish this communication basis that during the suctioning, if they're in any severe pain or discomfort, that they can blink their eyes or they can raise their hand for me to stop. So because of that pain, and just I want to establish that trusting and communication basis. And also, before we start, if anything were to go wrong, I want to assure that there is an obturator and a smaller sized trach at the bedside, so that these are here at all times. So first, to begin with, I'm going to wash my hands, perform hand hygiene, and then open up my sterile kit. And then put on my sterile gloves.
Two flies for the wagon.
Now that my hands are sterile, I can assure to start my suctioning. So before I start my suctioning, I can get the suction catheter, and with my non-dominant hand, I can grab the suction device, which now my left hand is not sterile, and then attach it to the suction catheter, testing if the suctioning is working. And then before this, I can get my sterile water and then put the tip of the catheter in the sterile water to sterilize the tip of the catheter, as well as applying suction to get that fluid within the catheter to make sure everything is sterile. And then also lubricating the tip so that as I insert the suction, there is less damage or irritation to the trachea. So now that the tip is nice and lubricated, I can come back, tell the patient to take some deep breaths because they're about to have their oxygen taken off for a second. I can remove the oxygen with my non-dominant hand, and then slowly insert the catheter, the suction catheter, until I hit resistance or the patient starts coughing. Then I will remove the catheter 1 to 2 centimeters, and then slowly apply suction to the trachea area for about 10 seconds. And as I apply suction, I can rotate the catheter between my thumb and my forefinger. So then that I will remove and then put the suction back on, checking their respiratory status and their O2 stats. And then I can do this for 3 passes or as needed for the patient. So then next, I can take off the suction catheter, remove it, as well as taking off the gauze underneath, making sure that the patient is still properly oxygenated. So next, I would take off my sterile gloves, but for the sake of this video, I'm just going to keep them on. And then now I can do trach care. So now I can open up a sterile field. This area is sterile. Set up my field. And then I would put on, I can have now have new sterile gloves. So for this, I would have my sterile water, pour it, and half of it in one container and then half of it in the other. Then I can throw this away. And then for my hydrogen peroxide, I can rip this open and pour all of it in one of the containers. So it's half normal saline, half hydrogen peroxide, and the other one is just normal saline. So as I remove that, I can remove their oxygen, so have them take some deep breaths, remove the oxygen, take their inner cannula out with my non-dominant hand, so this hand is now no longer sterile. I can let it sit in the normal saline and half hydrogen peroxide. And as I do this, I have to be very careful. I can grab my cleaning device while staying inside this box right here, not contaminating my sterile field at all in this field. So staying as close as I can, not making sure that nothing is spraying over my sterile field at all, keeping it nice and close to this container. Now it's nice and clean. I can avoid my sterile field and throw this away. Now drop it into my sterile water. And then with my dominant hand, I can pick it up. That's now sterile. Tap it on the side. And then insert. So now they have their new clean trachea on, and I can put the oxygen back on them. Next, I need to clean the incision site on their trachea. So this hand's still sterile, so I can grab a gauze, put it in the sterile water, and then grab it with my non-dominant hand and rinse it out. Clean the incision site, making sure to assess for any signs of infection or pain as I do this, or oozing out of the incision site. Then I can throw this away and grab the dry gauze with my other sterile hand and drying this area that just happened, that I just cleaned. So now that area is nice and clean. I can put the oxygen back on, throw that away. Then I would take off my gloves, wash my hands, put on new sterile gloves, and then I can get my gauze in the V shape, coming back to the patient, have the patient take some deep breaths, and ask the patient if I have an assistant to remove the oxygen. And then as sterile as I can without touching the skin, putting the V gauze underneath their ties. Making sure it is nice and secure. Then I can put the oxygen back on the patient. So after that, then I can assess the patient and their ties if they have, if they're soiled or if they need changing. Then I can change them by myself by doing it with one hand, or I can have an assistant come in, one of my fellow nurses, and have them hold the trach if I need to, and then I can retie the trach. So that would be the best to have two people, or you can do it with one. But the patient, as for this scenario, does not need their ties changed, so we don't need to do that. And overall, before I would leave, I would assess the patient. I can turn the oxygen back down and check the respiratory status, ask how they're breathing, and just auscultate their lungs, listening before I did the procedure and after, listening to how well the lungs sound now. And then that's just documenting how the patient tolerated it and overall how the procedure went.